An elevated temperature is a fever when it's greater than 100.4 rectally or greater than 100 taken orally. A fever can have a variety of causes. Fevers can be caused by viruses like common colds or influenza. They can be caused by bacterial infections like strep throat or a urinary tract infection. Oftentimes parents ask me what fever is too high of a fever. And I always answer them that there is no fever temperature that is too high. Fever is a result of something that's going on in the body. It's a symptom. It won't cause brain damage. It won't cause further illness in and of itself. So a parent should treat a fever if the child is miserable or feeling lousy. That's really the only reason that I would recommend giving a fever reducer. I would want a parent to call their pediatrician if the fever lasts for more than 5 days or if the child has other symptoms that may require treatment, like a sore throat or a rash. If a child has a seizure caused by a fever, the most important thing is to put the child in a position that they cannot injure themselves. So you want to put the child on the floor or the bed away from hard and sharp objects. You want to turn the child's head to the side so that they cannot gag or choke, and then you also want to avoid putting anything in the child's mouth. They will not swallow their tongue. Most of the time, if a child has a fever and a seizure at the same time, the seizure is over before the parent even has a chance to react. If the seizure lasts for more than 5 minutes, the parent should call 911. But most of the time the seizure is over so quickly that the parent doesn't have a time to react, but they should still seek medical care immediately. What I usually tell parents about fever is that fever is there for a reason, and as long as we can identify that reason, then I'm not too terribly concerned about it. Fever is a body's natural way of fighting off infection, whether it be a viral infection or bacterial infection, and it serves a purpose in that. You would treat a fever in a child to make them feel more comfortable, but it's not necessary to treat a fever. And there's no magical temperature that's going to cause brain damage in a child. There's no fever that's an emergency that needs to take a child to the emergency room. The only time that I worry about fever in a child over a short period of time, 3 or 4 days, for example, is when I can't identify a reason for the fever. So if a child has a fever and no other symptoms, that's when you would want to seek medical attention.